One of the myths that we had to debunk during this project was whether coronavirus could be cured with the use of antibiotics. This myth has been highly widespread during the pandemic due to the common association of antibiotics being the drug needed to endure common throat infections, such as bronchitis, laryngitis, and pharyngitis. This type of medicine is very effective and it is useful to treat such pneumonias. And since COVID-19 provokes similar effects on the patient that suffers from the virus, the non-educated guess would be to associate and relate the disease and the antibiotics as a cure to it.
This has an important social harming potential. Because since antibiotics are received needed drugs, they can cause a side effect if they are consumed without medical advice or without the well measurement. Because most of your body doesn't need these antibiotics in the first instance. So the economic impact is also obvious because people waste money in things that their body don't really need. And however, this has a consequence. It's most an individual consequence or familiar consequence because the pharmaceutics are earning money of these medical products that doesn't need to be sold in that giant way. So this isn't bad in economics for a whole community, it's more just like individually. This happens many times with a lot of medical resources and medical procedures.
The environmental consequence would be that the use of antibiotics would affect in serious ways the environment. If they're used without any conscience, throwing them without concern or any regard in how come these antibiotics later affect our surroundings, or simply not being educated in the proper recycling process, all of this would affect our community. As Frontline.org states, the release of increasing amounts of antibiotics into waters and soils creates a potential threat to all microorganisms in these environments, all of this endangering the species in your community. But now, is it true that antibiotics may be beneficial for coronavirus treatment? No. It is not confirmed that the use of antibiotics may be effective to treat COVID-19. First of all, because this disease is a virus, not a bacterial infection. Antibiotics may be only used for bacterial diseases, and coronavirus isn't one of them.
There's no discussion. Antibiotics don't help on the treatment of COVID-19 because this is a virus, in contrast with bacterial diseases, the main target of these drugs. The actual scientific debate begins when two medicines enter the game, chloroquine and hydroxychloroquine. They are two drugs that helped a lot in the treatment of malaria, a parasitic disease. There have been many studies about if this could actually be positive for coronavirus treatment, even with the approval of an acceleration on investigation from the FDA of the United States, but with no determinatory result yet. Actually, the most recent studies are pointing out that the rate of efficacy of these drugs is very low and possible consequences too high. The only medicines that have been proven to contribute to the treatment of COVID-19 are the anticoagulants, since the main cause of death in patients with the virus is thromboembolism, a symptom that refers to the formation of a clot in blood vessels, this causing strokes, heart attacks, and pulmonary embolism. These drugs highly decrease the rate of mortality in patients that suffer with this condition, making the anticoagulants the only known drug that helps in the treatment of coronavirus disease. It's crucial that you don't get fueled with any alternative unproven treatment, because they aren't just unknown to help on the disease, but they may aggravate it, possibly making the cure worse than the damage itself.
So in conclusion, antibiotics are definitely not effective against COVID-19. They have environmental, social, and economical consequences that not only affect the integrity of an individual, but can also affect their health in case of an overdose. This is why it is very important to inform that this is a myth and it's definitely not true and effective against the virus.